Hello, and how are you? My name is Winnie Barra. Welcome to a session on de-infibulation. If you're new here, this is a channel that focuses on lectures, lessons, and expert interviews pertaining to healthcare. This is a movement that is a consortium of the Girl Generation, ACAF, and the University of Nairobi. So working in partnership to ensure that we end the performance of FGM in our community. If you've been following the series, we've gone through different series of stages of explaining the different parts of FGM. Now in this video, we are going to explain in details what de-infibulation is, how is it performed, and why is it necessary. So in this case, when you've discussed the type of FGM, that is from type 1, type 2, type 3, and type 4. We've seen the different anatomical changes that happened when these procedures are done. But in this case, we're going to explain how the infibulation is done and why the intervention is important for women who have gone through FGM. If you're new, don't forget to subscribe, give our video a like, and be part of our family. So let's introduce first, what is de-infibulation? So de-infibulation is a surgical procedure that is done for the purpose of reversing infibulation. How? By cutting open, okay, the narrowed vaginal opening in a girl or a woman who has undergone through type 3 FGM. So I want to emphasize on the FGM type 3 FGM. So in our class of FGM, if you've not watched, you can go back. We have a whole video on it that we've explained the type of FGM. In type 3 FGM, we also call it infibulation. So in the infibulation type of FGM, there is a removal of the vulva or the lips, and then in the external lips or in the labia majoris, they get to be sutured at the middle here. So what the de-infibulation procedure done, it goes ahead to help us to open the gall or the lips so that we can free the area and to allow easy access into the vaginal opening. Because during the infibulation procedure, the opening is closed and we are not able to access the vagina in this case, or the opening is so narrow and tight that there is no adequate space for the lady in case she goes through labor and delivery. So there's another term that we can refer here again that we call re-infibulation, what is called resuturing. So we are told resuturing or restitching, also calling it re-infibulation, is normally a process whereby there's restitching of the type 3 or to reclose the vagina again after childbirth. Very cruel, and we're told this is illegal. It is illegal for person to re-infibulate once you have opened a woman already that she can go through labor. So in some cultures, it's said that when a woman has gone through type 2, type 3 FGM, and she has to go through labor and delivery, after completing her labor and delivery, that is, they have opened the way and she has allowed her to give birth, she's supposed to be sutured back again, rather to reclose the vagina again after childbirth. This is not allowed, this is illegal, and if one is caught, they can be presented before the court of law for criminal injustices, or presented for an offense. So in this case, once a woman has been de-infibulated, that lady is not supposed to be closed again, or she's not supposed to be re-infibulated, or rather you need to let the opening to be open and you should not close it again. So let's explore the indications when the infibulation is done. So number one, it can be done in cases where it is the woman's choice. So the woman has consented, she has allowed to be de-infibulated, or rather to open the sutured opening, and you want to let her vagina to be free. So it's also done to reduce the risk of complications during childbirth. Remember the case where we have done an antenatal care of our mother, and we've done clinical examination or physical examination, and we've discovered that through the digital exam, she is not having adequate vaginal opening. So in this case, we may want to do the infibulation to reduce any risk of complications that may come up during the childbirth. The other reason is it's going to help us facilitate diagnosis and management of any form of obstetric complications that require pelvic examination. So during the physical exam, you may discover that the woman is actually at risk of obstetric complications and you want to reduce these risks. So you may go ahead do de-infibulation to just facilitate easy diagnosis and management of identified complications. Then next is you can allow gynecological procedures and management of conditions that require pelvic examination or treatment vaginally. So for example, you have identified that by doing the physical exam, you discover the woman actually has risk of recurrent UTIs or recurrent vaginal infections, and in this case, you want to manage this. So you can request for the infibulation, as part of the interventions, and you want to treat these conditions. And the other reasons you can indicate for the infibulation is to allow easy treatment of conditions that are arising from the infibulation procedure. For instance, you discover the lady was done infibulation, she's having complications like keloids, she's having neuromas, or she's having any related complications from the type 3 FGM. And in this case, you want to treat these conditions. One of the indicators or one of the treatment will be doing the infibulation. And then the other indication is to allow to facilitate for the use of certain types of family planning methods or tampon usage. Remember, even if the woman has undergone FGM, she has a right to access family planning methods, and it is in this regards that we may encourage her to go through the infibulation to allow use of certain types of FP methods, for example, the IUCD, or if she wants to insert tampons. So this is very critical. However, in cases where there is an indication, always remember there could be an indications. If the women decline to undergo the procedure despite adequate counseling, this is one area that you may be allowed not to give the infibulation. So you've done your part as the healthcare worker, you've explained the benefits of her going through the procedure and the significance that it can play in promoting her positive outcomes in any management during the process. Then you may be allowed not to do it if she has declined and she has refused to give consent. However, if you allow and the woman has accepted and she has consented to go through the procedure, but now you are intervening and you're taking her through the infibulation, but you discover that during the procedure, the scar tissue cannot be cut, it is hardened and it's becoming difficult for you to remove it, then you can actually contraindicate or you can actually stop the procedure and not force through with the infibulation, because it could be while you try to force the infibulation process, it can lead to further complications or it can lead to further steps that may not favor the woman, or it can lead to more complications. So you can actually contraindicate for that. So you can see there are two stages that you can contraindicate the infibulation. One of it is cases where the woman has not consented even with adequate counseling. The other part is you've seen that the scar tissue is really hardened and cannot be lifted or cut. So you can stop with the infibulation processes. And this brings us to the last part of our class. Thank you for staying with me to the end. I always encourage, please remember to comment, share, and subscribe. Like this video. Click on the bell so that we can notify you when we post our next class. Till the next class, thank you very much and see you.